we can fix things, we can cure things. We may be able to actually remove something so that a patient may be able to conceive naturally as opposed to resorting to IVF and fertility. Sometimes patients who failed transfers, it's because of the fact that there are irregularities that have not been eliminated inside that uterus. There's an extremely underutilized tool in our toolbox. It's called a hysteroscopy. Hysteroscopy is a procedure where a small, thin scope, which is usually connected to a camera, connected to a video monitor, is inserted into the uterus in the same direction that a person would be having a embryo transfer or any type of procedure to evaluate the uterus. And by putting a scope into that uterus, you can look into that uterus to look for any type of abnormalities. But along with that procedure, you can actually clean out the uterus. You can actually remove things that will prevent you from getting pregnant. Unfortunately, a lot of the doctors will be using this procedure in an underutilized fashion, in the sense that what they'll be doing is they'll go ahead and they'll look inside at a random event, random time, and they'll look inside and say, look, there's nothing really abnormal here. We're good. And then they'll go ahead and move forward with procedures such as, well, any of these type of procedures, time intercourse, IUIs, embryo transfers. How is this different from what your routine doctor is doing on a regular basis? Number one, timing. So I find that the timing is really important. Trying to perform this as soon as the period has sloughed off, removed all that lining, exposed what is abnormal, and then we have to do it early enough so you don't get the new period coming in. This is not an easy thing to time. We have a special protocol that we actually use here, so we can time it where the period is done, whatever we see is abnormal, but we're not going to be blinded by the new lining, which is basically like snow over a landscape. What is going on underneath there? So the timing is really important. Once you get the timing done, anything that doesn't look like it belongs there needs to come out. Now, how it comes out, what we routinely do is we use basically miniature tweezers, or what we call polyp forceps. They're not sharp. We're basically pulling and teasing any type of irregularity out. Now, in order to kind of remove a lot of these trimmings from inside the uterus, I often will use what's called a curette. You'll hear this term DNC, dilation and curettage, and everybody is always nervous. Oh my God, you're scraping my lining. But the curette is not a sharp device. It is not that much different from those tongue blades that you buy in the pharmacy to clean your tongue. That's not cutting into your tongue. You're just scraping off the old tissue that's causing your bad breath. And in this case, with the curette, you're removing that tissue, the loose tissue that you pulled off, so it doesn't irritate your uterine lining. So with that in mind, we're taking this one step further, and what we find is that number one, we find a lot more abnormalities than what's seen on a random hysteroscopy done aimlessly in the cycle. Number two, we can fix things, we can cure things. We may be able to remove something so that a patient may be able to conceive naturally as opposed to resorting to IVF and fertility. Sometimes patients who failed transfers, it's because of the fact that there are irregularities that have not been eliminated inside that uterus. So this is what you can call it fertility hysteroscopy, therapeutic hysteroscopy, cleaning hysteroscopy, but this is something that I think is a very underutilized tool in the fertility toolbox.